This segment of DelmarvaLife is sponsored by Tidal Health.
Another emerging health crisis is making the news. This comes on the heels of the hantavirus infections on a cruise ship. Central Africa is in the midst of an outbreak of Ebola in the Democratic Republic of Congo. And most recently, an American doctor treating patients there has tested positive for the virus. He's been relocated for treatment, but now the World Health Organization fears that there could be upwards of 600 cases due to this outbreak. It's considered a public health emergency, but not at pandemic levels. But what exactly is the Ebola virus? It's a disease that can spread through direct contact with bodily fluids that can cause severe flu-like symptoms like fever, headaches, muscle aches, and fatigue. This can ultimately progress to serious gastrointestinal distress and hemorrhagic fever. It historically has a mortality rate of 25 to 50%. So it's only natural that public concern over something like this should be taken seriously and questions be addressed. And when we want the straight talk on a topical health issue, we turn to the experts at Tidal Health. So we brought in Dr. Chris Snyder, Chief Quality Officer and Physician Advisor with Tidal Health. Thank you for being here with us.
Thanks for having me.
So right off the top, what should people know about this current situation?
Yeah, it's pretty isolated to the Congo and Uganda. And again, this is one of these diseases that is extremely contagious from a contact standpoint. So it's hard to isolate, especially in a rural area, because they really don't have resources to help support putting them into an isolation. And there is such an ease of contamination with this, it's a very challenging disease. South Africa, you see it a lot. You see it in South America, and again, it's usually in isolated areas, it's just a tough disease to control.
So what are the actual, like, how is it spread, and what are the symptoms, and what should people, what are the misconceptions about it?
Yeah, so unfortunately, it's one of these viruses that lives and people remember the pictures of where they had grave sites dug up, and Ebola can live for weeks on the body of a deceased individual. So it's one of those that you really can't get rid of. It's very difficult to kill it. This virus has a lot of survivability capabilities that makes it difficult. So the contact bodily fluid, any bodily fluid, so it's very also difficult for healthcare providers to take care of. It puts us at a huge risk when we have Ebola patients. So fortunately, we've not had any in the U.S., and so that's a good thing. But again, they're isolating it. It is usually carried through, obviously, by travel. So those are one of the areas where we focus on, is screening folks for travel.
So there's a lot of misinformation out there. A lot of people just get random things off the internet. I mean, how do we determine whether what people are hearing is legitimate or not?
Yeah, CDC, best site. So stick with the folks who do this for a living, who share the information. They're pretty concurrent. We're going to be open with you about it. I mean, it's not something secret, and it's good. The more awareness around it, the more questions that can be asked by your healthcare team when you come through the building with illness. Because obviously these people get sick, right? So they come see us. So in the screening around that's super important. But World Health or CDC, if you're going to go to a site, go there. Please stay off TikTok with us. It doesn't do any good to talk about. This is a very bad and very dangerous disease, as you said. I think one of the wise things to do is, if you do have questions, call a healthcare provider, somebody who can at least look at it and read with education around knowledge around viral transmission.
And in the world that we live in these days with Ebola, and you mentioned it's not any cases here in the U.S., but with other infectious diseases like that, your staff and the folks at Tidal Health have to take precautions to be prepared, don't you?
Yeah, well, infectious disease in general, it's about 50% of what we do is take care of sepsis. So, and obviously all infections, pneumonia, cellulitis, you name it, blood infections, infections from urinary tract infections. It's one of those things of, you're failing the environment, so your environment's actually attacking you. So these are bugs and pathogens that live in the environment, and some folks are higher risk for it. With Ebola, it doesn't really care what risk you're at. It's a contact disease, and it's very aggressive, unfortunately.
So if there are folks who are watching, maybe they're feeling anxious about all this and they don't really know where to turn, what would you say to them right now? So
right now the risk in the U.S. is very low. Travel advisories have gone up significantly. So all your airports, folks coming in off cruises, et cetera, there's an assessment being done by folks asking them if they have symptoms of flu. Ebola is interesting. It has like a dry phase in the beginning where you get common cold type stuff, cough, fever, chills, sweats, and all that good stuff. But then it turns into this liquid it, or they call it the wet phase, where they actually get diarrhea, vomiting, and that's where you get the problem, because what did I say? Contact is severe with Ebola. So any of these hemorrhagic viruses cause that kind of transmission. So once it gets wet, it's very transmissible just because of the massive amount of fluids that are excreted from the person. And then they get hemorrhagic, which is bleeding. And the bleeding is what is very dangerous, especially in folks who are immunocompromised or elderly.
It's easy to see how people can get scared of because what you just described.
Absolutely.
And how it escalates. But I guess if folks have any questions, check with their physician.
Yeah, most definitely. And travel advisories are out there. You're going to see them. Again, don't read into those. Ask somebody who's an expert in this. A little knowledge is dangerous when it comes to this kind of stuff. Viruses, we do have some treatments for Ebola. The particular one that's out there right now, though, unfortunately, there's no antiviral agents for it or vaccines. So, but I'm sure technology will figure that out in the next few years.
Right. Dr. Chris Snyder, thank you so much for coming in, kind of clearing the air a little bit about this for us.
Thank you. Appreciate you having me.